Thank you for calling PACU. How can I help you? Okay, thank you. That was a call out on Dr. Williams' patient?
I still have this other patient that I've been trying to call report up to the floor for the longest time. It's been at least a half hour. Let me call him, try again, because I need to move some of these patients out of here. Hi, can I talk to the nurse that's going to be taking the patient to room 510? She's at lunch now? Earlier she was off the floor for I don't know what reason, and then she was in the patient's room giving medications. I need to talk to the charge nurse now. Hi, yeah, this is David over at PACU. I've been trying to call report on this patient that's supposed to go to 510, and I keep getting the runaround that the nurse is off the floor or at lunch, and it's been going on for at least an hour. This is just unacceptable. I'm going to call the supervisor and tell him what's going on. So get Nurse Nancy on the phone so she can take report now, or else I'm letting administration know. Thank you. Hi, Nancy? Yeah, this is David over in PACU. I've been trying to call report on this patient for the longest time, and I keep getting the runaround. I need to move some patients now. I have patients that are coming out, alarms going off. You need to take report now without any more delays, okay? So I have Dr. Ordine's patient, and they're going to 510, and they had a hysterectomy, and they're doing just fine. Vital signs are good, okay? So if you have any questions, look in the chart. The patient's on their way. I mean, I tell you, my job is recovering critical patients that come out from the OR. All your job is just to take report on the patient. So just do your job, okay? Can't believe those four nurses.
Well, David, don't you think you were a little hard on her?
What do you mean?
All right, well, you know, in one of the classes I'm taking, we just covered the topic on incivility and bullying. I want you to just check out some of these articles that we've been reviewing, okay,
Yeah?
for class. In our textbook, Masters references the Joint Commission's stance on disruptive behavior as undermining a culture of safety by intimidation and disruptive behavior, which creates room for errors and mistakes to happen in patient care. It also affects patient satisfaction and can affect length of stay and increase cost to the patient. All right. The Joint Commission has ranked communication as the third highest category for sentinel events.
Sentinel events? I thought that was like when patients die.
Well, no, it's not just when patients die. And let's look at another article here from ARN. They discuss bullying behavior and incivility in the workplace. They describe it as a form of lateral violence that consists of overt aggression by belittling, criticizing, yelling, finding fault, and obstructing patient care. I recently read an article about lateral violence in nursing, and the authors describe how it leads to increased stress. Now, we already have a stressful job as it is. A depression, powerlessness, post-traumatic stress disorder, and their job performance is affected. So, and just one more thing, let me see. Look at here. It says it can affect the patient's safety by disrupting teamwork and effective communication. Here, for our job, the ANA and the ANA Code of Ethics with interpretive statements in provision 6.3, you see here, it says nurses are responsible for contributing to a moral environment that demands respectful interactions among colleagues, mutual peer support, and open identification of difficult issues. So, not to mention, in our code of conduct, to help cultivate justice in the workplace, we are instructed to treat coworkers with respect, courtesy, consideration. Just think about that. And workforce violence and harassment will not be tolerated. It goes against the organization's values of respect and collaboration.
Wow. You know, I didn't really think about that. I kind of feel really bad. I mean, I caused all that stress to that nurse, and it wasn't really her fault. I mean, it's me needing to manage my own stressors and priorities. You know, to do the patient right, I need to call her back and give her a proper SBAR report, because I know I didn't give her all the information, and it's ultimately affects the patients, and that's what we're here to protect. So thanks for letting me know that stuff. Let me give him a call again.
Sounds good.
Hi, this is David again. Could I talk to Nurse Nancy, please? Hi, Nurse Nancy. This is David again. I'm sorry about earlier. I really was out of line in how I gave you a report. I just had a lot of stressors going on over here and things going on with me, and I shouldn't have taken it out on you. If you don't mind giving me the opportunity, I'd like to be able to give you a proper SBAR report. That way we, ultimately are taking care of the patient. So anyways, I have, this is Miss Miller, Dr. Ordine's patient. She's supposed to be going to room 510. She just had a hysterectomy today, and she did great with the procedure. There weren't any complications. She's only main complaint was for some pain. I did give her 2 milligrams of Dilaudid total, with the last dose being given 20 minutes ago. Her latest pain rating was a 2 out of 10. She didn't complain of any nausea. She has a IV site. She has a 20 gauge in the right hand with LR going about 75 mLs an hour. She has a dressing to her lower abdomen. There's a 4x4 ABD and a Metapor tape. No drains coming out of it. She does have a Foley catheter, and I emptied about 100 mLs in his clear yellow urine. SCDs are on. Vital signs have been nice and stable, and if you have the chart open, you can see where I validated the vitals, and let me know if you have any questions. She does have family out there. I already talked to them, and we're going to make sure that they come up with her belongings up to the floor. So if you do have any questions, I'm here until 7 o'clock, and please don't hesitate calling me. Again, I apologize for how I acted earlier, so give me a call. Bye. I feel better about that. I was able to use the SBAR, which is another tool for giving a good communication tool, and going over the situation, the background, my assessment, and our recommendations for the patient. So again, thanks for catching me on that, and I hope I don't do that again. Okay.
No problem. And overall, it's all about the patient.
You're right. That's all about the patient. Thanks.